The very first case of the new coronavirus strain in the U.S. turned up in a remote part of Colorado, in the town of Simla, population 600, at this nursing home.
The individual is a man in his 20s who is working in Simla, not recently traveled. He's currently recovering in isolation, mild symptoms.
He's one of 2 Colorado National Guard members who were sent to help with staffing at the Good Samaritan Society facility. The other guardsman is suspected of having the same infection. All 24+ residents of the home had already tested positive for COVID-19.
We have an extensive investigation underway to identify all contacts the cases may have had in the 2 weeks leading up to their deployment, as well as any other contacts outside of the facility they may have had during their deployment.
The B.1.1.7 COVID variant was first identified in the UK, is believed to be responsible for more than 60% of cases there, and has now spread to some 36 countries. The strain is more transmissible than the original virus, but it's not clear why.
It could be because the virus replicates faster, and so you get higher viral loads, which means you're more infectious.
But experts don't believe it makes illnesses any more severe.
There's no indication at all that it increases the virulence, and by virulence I mean the ability to make you sick or kill you.
This new variant has been identified in 3 U.S. states, Colorado, California, and Florida. Experts suspect it's present and spreading in many more. Just as coronavirus infections are showing signs of leveling off in the U.S., the concern is that the new variant could cause cases to spike yet again in the new year.
If you're ill, instead of only making 2 or 3 other people sick, you might actually spread it to 4 or 5 people. And of course, with more cases come more hospitalizations, more ICU beds being filled, and the potential of overwhelming our healthcare system.
The variant does not appear to cause reinfections in people who've recovered from the virus, and it's believed the new COVID-19 vaccines will be able to control it. It's proof this type of virus mutates easily.
The bottom line is that we need to suppress transmission of all SARS-CoV-2 viruses as quickly as we can. The more we allow it to spread, the more opportunity it has to change.
Meantime, Colorado authorities are investigating how the new strain surfaced here in the hopes that its spread can be minimized or at least contained. HENDRIK, SYBRANDY, CGTN, Denver.